My name is Dr. Smith. Is your name Mary Gordon?
Yes, doctor. Nice to meet you.
How are you feeling today?
It's a feeling in my chest. I can't say it's pain. More like discomfort. Like a pressure or a pushing feeling.
Where are you feeling this discomfort?
Right here, in the middle of my chest.
When do you feel this way?
It's probably worse when I'm active, and it tends to settle a bit when I rest. I just can't say it just happened all overnight. It's gradually gotten worse over time.
What does the discomfort feel like?
It's more like a pressure or a crushing feeling.
Does the feeling radiate? Does it spread anywhere in your body?
It's only just here in the middle of my chest.
Do you feel anything else with this sensation?
I'm really short of breath. I just can't seem to get enough air.
When does the feeling get worse?
It's even worse at nights. I even wake up with the same feeling.
Is there anything that makes the feeling get better or worse?
I usually have to sit up in bed, and after a while I feel better, but still very breathless. Nowadays I just prop myself up on a few pillows.
How would you rate the pain that you feel on a scale from 1 to 10, 10 being the worst and 1 being the least?
It's not really pain, it's so hard to say. It's just very uncomfortable though.
Do you find it very difficult to breathe?
I feel very breathless, doctor.
How long have you felt like this?
It has gradually gotten worse over the last 5 years. Especially, initially I just noticed I couldn't do as much work around the house. Or I was breathless when I only climbed a few flights of stairs. Now I'm breathless even when I rest. I don't particularly feel much pain though.
How do you feel when you exercise?
I can't really do any exercise now, doctor. Any amount of activity leaves me very breathless. And I just have to stop and sit down for a while.
How many pillows at night do you use to sleep?
I use 3 to 4 pillows, actually. It gets worse at night. Sometimes I wake feeling very breathless and I have to sit up in the chair. I usually wake up feeling very breathless and or have to go to the bathroom.
Have you woken up in the middle of the night feeling breathless?
At night I can wake and feel very breathless so much I have to get up and sit in my chair. In fact, I even sleep propped up. If I can feel much more comfortable when I sit up.
How does the breathlessness affect you?
It's very bad, doctor. Now it's so bad, my real life really isn't what it used to be. I can't play with the kids. I don't work anyway. I had to stop helping out at the charity shop, and my whole life is just terrible now. I can hardly do anything without this desperate feeling to breathe.
What about coughing?
I do have a cough, yes, especially at night. Most times it's just some pink frothy mucus. Only once I was scared when I saw a bit of blood. Come to think of it, I didn't have a fever or anything like that, though.
Have you ever felt dizzy?
Sometimes I feel a little lightheaded, then I just sit down. Never really fainted.
Mary, have you ever been aware of your heartbeat?
Come to think of it, sometimes I feel a strange pounding. An unpleasant fluttering sensation in my chest, but it settles by itself.
Mary, are you feeling any pain in your legs when you walk for a short distance?
No pain in the legs, doctor, but I feel extremely tired after walking short distances, especially just moving around the house.
Have you experienced similar attacks like this in the past?
It's just gradually gotten worse and worse over time. I'd say this is initially, I just noticed it when I went to the gym. But the last 3 or 4 years, it's been gradually getting worse and worse and really affecting my life.
Is there any history of high or low blood pressure?
My blood pressure was measured yesterday, and they did say it was on the low side. Certainly, I hadn't any blood pressure problems pointed out before. But then I haven't been to the doctor much.
Have you ever been previously diagnosed with these symptoms before? And have you ever seen a doctor for these symptoms before?
I've avoided doctors all my life, really. I was a very healthy person. I knew something was wrong. I just didn't want to face it. But now I'm so bad, I had to come into the hospital.
Do you have any history of asthma?
I've never been diagnosed with asthma. I didn't have any breathing problems when I was a kid. I've never taken any meds for asthma, no.
Do you have any allergies to food or drugs?
I'm allergic to penicillin, that's about it, really. I don't know of any food allergies.
Do you have any history with cancer or any malignant tumors?
No, I've never had any cancer. Do you think that's what's wrong?
Have you ever been diagnosed or treated with some type of heart disease?
I've never had any previous problems. I thought, but they sent me for some cardiac tests yesterday. I remember suddenly that I had a funny racing sensation in my chest.
Have you ever had any previous chest infections?
Nothing serious, just the usual coughs and flus. I've never been hospitalized before.
Have you had any previous surgeries?
No, doctor, never.
Have you had any problems in the past? Any other problems?
No, never. Just this terrible breathlessness and discomfort.
Does anyone in your family have issues with asthma?
No, no one has had any asthma that I know of.
Does anyone in your family have chronic obstructive pulmonary disease or COPD?
That's a lung problem, right? Nope.
Any family members with heart disease of any kind?
Yes, my father has angina. He is very overweight, though.
Are there any family members with cancer or with malignant tumors in your family?
I think my grandmother had Stomach cancer.
Is there any family history of diabetes, high blood sugar?
No one has diabetes in my immediate family, although my husband's mother has it.
Is there any family history with blood clots?
I don't think so.
Anyone in your family have a history of hypertension, high blood pressure?
My dad has high blood pressure. He is on meds for it, that and statins.
In your family, are there any common allergies?
Nothing major, no. Not that I can't think of right now.
Do you smoke, or does anyone in your home smoke?
None of us smoke at home, no. Never have.
Are you working now?
I don't work, doctor. I used to volunteer at the charity shop. But I stopped over a year ago. I just couldn't cope anymore.
Do you drink any alcoholic beverages during the week? And if you do, how many?
I like a drink. I have a bottle of wine that lasts me 2 evenings or so. I don't think it's excessive, though.
Do you take any drugs?
No, never. When I was in college, I smoked weed a couple times. I've never touched it since, though.
Do you have any pets?
No, I'm not a pet person. Kids are always bothering me for a puppy, though.
Do you have any children?
Yes, 2. A boy and a girl. They're 14 and 12. I remember I felt breathless in pregnancy with them, actually. I just assumed it was part of pregnancy.
Are you having any marital problems? And has this condition affected your sex life?
Been with my husband for 20 years this year. He's a real sweetie. Worried about me, obviously. But no marital problems, no. Not that I know of, anyway. To be honest, I feel bad for him because we really can't have sex now. I'm just so tired. And I feel tired most of the time. And I feel so bad with my breathing. It's not exactly been a priority.
Are you currently taking any medications?
They gave me something this morning. Not sure what it was. And they told me I'd get drugs to take. Something to make me pee, he said. And something to slow my heart rate down. I'm meant to be getting them soon.
Mary, I'm going to do a little examination of you. I'm going to check your chest, hands, eyes. Is that okay with you?
Sure, doctor. Want to do whatever you need to do.
Mary, you look a little bit pale to me, and your cheeks are red. Mary, may I examine your hands? Your pulse is 120 and it's irregularly irregular. And I notice that your hands are bluish. Mary, I'm going to take your blood pressure. Can you give me your arm? Mary, your pressure is 100/70. Mary, I'm going to examine your eyes, head, and neck. If there's any discomfort, please let me know.
Okay.
Mary, I need you to open up your mouth. Go, ah. Okay. Mary, I'm going to examine your chest. I'm going to inspect. I'm going to tap, press, and listen. Is that okay?
Yes.
Okay, can you move your gown? Now I'm going to listen. Mary, can I ask you to lay down so I can examine you? Mary, can you turn your head so I can look at your neck, please? Mary, I'm going to inspect your abdomen. I'm going to press lightly and then firmly and listen. And if it hurts, will you let me know?
Okay.
Okay. I'm going to lower your gown. Mary, I'm going to examine your tummy. I'm going to listen, press, tap. Is that okay?
Okay.
This shouldn't hurt, but if you feel any pain, stop me right away. Now I'm going to listen to your stomach. Any pain?
No.
Here? Here?
No.
Here? Now I'm going to tap. Any pain, Mary? I feel your feet are cold and your ankles are swollen. And you see here how I press, how it indents? That's called pitting edema. Mary, I'd like to examine you. May you lie down,
Yes.
please?
No.
Mary, the examination's over. Do you need any help getting dressed?
No, doctor.
Okay, thank you.